Hello, everybody. Thanks for having me. There's nothing like being at the end of the day, right? It's not like last year. I promise I won't have a pre-recorded thing that puts you to sleep. So first of all, that's a win, right? Second of all, because, Dustin inspired me earlier to not be boring, I am going to just, give you a few jokes that you can take home to your kids. First, and they're about chickens. So who doesn't like chickens? I love chicken jokes. So first chicken joke I'm going to talk to you about real quick before I start anything is, what do you call a funny chicken? Anybody? Nobody. A comedy hen. So anyway, we will get moving here. We're going to skip through Medicare. I know you'll like that because they talked about it earlier. So we're going to go straight into what is new. Oh, and starting off, I'm telling you what, with a really heavy subject, but anybody heard of the Inflation Reduction Act? Show your hands. Anybody know what it is? All right, we're going to give you a crash course. So the Inflation Reduction Act was something that was signed into law in 2022. It went into effect in 2023 with a 3-year rollout plan. It affects all Medicare Part D plans, so plans that have prescription drug coverage. That means Medicare Advantage prescription drug, as well as the prescription drug standalone plans. In 2023, it started off with a few changes. You can see them up there. It put in a $0 cost share for Part D adult vaccines, and it established a $35 a month maximum limit on insulin. In 2024, this year, it changed to a $0 cost share on covered prescription drugs. It's called true out-of-pocket cost whenever that member reached $8,000. They entered a catastrophic phase and they paid $0 after that. And it's also expanded the low-income subsidy or extra help to full benefits for members or individuals with incomes between 135 and 150% of the federal poverty level. So those are the fun things that it already did. Now we're going to talk about the really substantial changes for 2025. These are the things, if you've heard any of the rumblings, if you've read anything about costs going up, about benefits possibly changing out there in the market. So I'm talking in the news, anything like that as a result of the Inflation Reduction Act. The changes are why this is happening. So the first one is, and trying to make this as simple as possible, because trust me, it's really complicated. But the coverage gap stage, or what used to be called the donut hole, if you've heard of that, is going away for 2025. The drug stages are going to be the deductible, if there is one on the plan. The initial coverage stage, so that's when the co-pays or the co-insurance applies, and the catastrophic phase, which is when the member goes to zero, so when they're capped. And what's changing, and this is significant in 2025, is the total out-of-pocket cost for Part D drug costs will be limited for a member to $2,000. So what this means is that after the member and also any others on their behalf, like the plan, have paid a combined total of $2,000 for their Medicare D covered drugs, they move from the initial phase to the catastrophic phase, which means they go to zero. So that's huge. And it's called Inflation Reduction Act, right? So it's reducing the amount that the member will pay, but that cost has to go somewhere, and we'll talk about that in a second. The other thing that it does is that it also allows Part D enrollees to have the option to pay their out-of-pocket prescription costs in monthly installments over the course of a year. So instead of at the pharmacy point of sale where they would pay their copay or their deductible or their coinsurance, they would pay $0 if they sign up for this program, which is called the Medicare Prescription Payment Program. We'll talk about that more in a second as well. So I mentioned cost, and really how is this affecting everything? Because this is applicable to all plans, so all carriers, all plans, and this is something that was rolled out through the Inflation Reduction Act, these changes are huge across the board, as I mentioned, because of where the cost goes. The financial responsibility for the plan has changed for everybody, so it's changed for the member. I mentioned it goes down. It changes for the CMS or the government, so it also goes down for the government. So it goes down for the government, the member responsibility goes down, but it increases both for the manufacturer of the drug, but hugely for the plan. The cost has to go somewhere, right? Money just doesn't go away. It has to be, it has to go somewhere and change. So that's what's happening, and that's what's really causing plan costs to increase. So I mentioned that this is happening across the board everywhere. Well, LGHIB has been able to retain their benefits as is for 2025, which is fabulous. The majority of the health plans that we work with and that we talk to are considering benefit changes and possibly premium changes as well. So again, if you've heard any mention of this, if you've read that some plans maybe individual-wise are leaving a particular service area or they're changing benefits, it's all driven by these changes because they're hugely expensive to the plan. A large part of the reason that LGHIB has been able to stay where they are is the foresight the team has had, really, especially around the plan's drug benefits, and it put them in a much better position going into these changes. So I think that's really fabulous. The benefits are exactly the same as they were, and those tough conversations don't have to be had about that. So I am going to keep going, and actually I'm going to stop for 1 second. Any questions on that before I move on? Because that's the majority of the change for this year. And as Rob said earlier, these aren't changes that are made to the plan by the plan. These are changes from the government. So, and how they roll out and affect all plans. So I just want to make sure, it's really confusing, but hopefully everybody understand a little bit about it now? Yes? Okay. M3P. Try to say that and not MP3 after you've said MP3 for a really long time. It's really difficult to do. But what is it? Again, I mentioned this is the program that members have a choice if they have Part D to sign up for, which allows them to pay not at the pharmacy, but in a monthly amount to the plan for their prescription drug costs, their responsibility under the plan. So it's something that is it's a unique benefit. It's a really good benefit for certain people, but not so much for others. And you can see on the screen who it benefits for. So while everybody could enroll, the individuals that typically would have a higher cost sharing earlier in the plan year are more likely to benefit from enrolling in the program. Those with a lower cost share during the year or who are not likely to reach that $2,000 that I mentioned would really not be beneficial for them to join or to participate in this program, or those that have extra help or a government program. So again, it's a really good thing, but it's a good thing for those that have that significant cost at the beginning of the plan year. And how it works is that a member can sign up online. They can call us. They can also do it, by mail. What they can't do is they can't sign up at the pharmacy. So if somebody wants to do this at the pharmacy and they talk to their pharmacist about it, they can't do it right there. They have to enroll before they would go pick up their first prescription under the program. What happens is, if you think about it, almost like a electric bill or a gas bill, if you pay that average bill during the year and you fluctuate, your usage fluctuates and your payment fluctuates, it works very much in the same way. So if you add other prescription drugs during the year, that can cause that amount that you pay per month to go up. Hopefully that makes sense. We'll look at a second about the member journey. So this is really what happens. So the member finds out about the program, and they can find out about the program in a number of ways. They can find out on our website. They can find out by calling in customer service. They can also find out from their pharmacist or their physician. Once they find out and they call in to us and they enroll, they opt to enroll. And again, I mentioned they can do that online, over the phone, or by mail. And then the member would pick up their prescription at the pharmacy and pay $0 copay for it at that time. The plan would cover the cost, and then the plan would reach out to that member and give them an invoice per month. And again, as the member accumulates additional prescriptions, those prescriptions will change that monthly amount that they owe. And so the member pays their bills on time, and at the end of the year, it's even. So again, that's really the way that it works. It will be effective January 1, so we'll see how this all kind of plays out. I do think it will be beneficial for some people, just not all people. So again, just keep that in mind. We are going to jump into benefits, but we're going to do this kind of quickly because I know that you know the plan benefits. But before I do that, I'm going to ask you another question. What do you call a chicken who's good at math? anathema chicken. That is my favorite chicken joke ever. So go take that home, and it's really corny, but it's a fun one, right? All right. So just a reminder, underneath the MAPD plan with the LGHIB, members can go where they want to go. Their in-network and out-of-network benefits are exactly the same. And as far as the network goes, they're not required to see a network provider in the United Healthcare Network. Providers may already be a part of our network, but as long as they are willing to accept Medicare and to bill us, we'll go ahead and pay in the same way that we would pay an in-network provider, and the benefits would process and pay the same. So again, really easy. If there's ever any question about that, members can call the number on the back of their card, and we'll actually reach out to the provider for them and ask them those questions if they will file and if they participate with Medicare if they don't know. I'm not going to go down through these. The benefits have not changed. So the copays stay the same and the medical. So everything, again, in network and out of network is the same. So members, it doesn't matter, again, if they go in network to a provider that participates with us, or if they just go to somebody that participates with Medicare and will bill UHC. Preventive services have a $0 copay. And again, that hasn't changed, but it's a really good opportunity for members to make sure that they're getting their preventive health services in the way that they should be. Prescription drug benefit copays have not changed either. And you can see on here that as far as the plan goes, on generic drugs, they have a $10 copay. There is a deductible for tiers 2, 3, and 4. And again, those are preferred brand, non-preferred drugs, as well as specialties. And again, they can get a 30-day retail supply at the pharmacy or a 100-day supply pharmacy, or a day supply at the pharmacy as well. I'm asked a lot, why should somebody think about joining the LGHIB MAPD program? So what differentiates this program from other programs out there? So we all know that members have choice. We all know that come open enrollment, they can get bombarded with all kind of materials and phone calls and all of that fun stuff, and they get really confused. So the value added benefits in your plan. So what's in your plan that makes it special, I would say? And I'm going to talk to you about a few of them. I did last year too, but just to call out a few things. First one is House Calls. House Calls program is an amazing program. It's a program where we actually go out to one of your members' homes. We spend up to an hour with them. It's a practitioner that can talk to them, do medication reviews. They can do screenings that they might be eligible for. They can also just answer any questions that they might have, because how many of us get home from the doctor and we don't remember to ask all the questions at the same time? So it's a wonderful way to kind of fill in that gap. And the really great thing about it is we also ask them about other things that they might have issues with that maybe aren't medical. So do they have any issues with, making sure that they have enough food? Do they have any problems with their housing? Those kind of things, so that we can make sure we refer them to some help for them in those areas if they need it. And we also send a visit summary to their primary care physician. So it's a really wonderful thing. Again, we can do it virtually if they don't want to do it, in their home. And it's something that we really hope that people take advantage of, and I love to talk about because members absolutely love this benefit. Renew Active. So I know you all know what Renew Active is. It's our network of national fitness centers across the country. So we also do on-demand workout videos. Members can really engage with that however they want to. And last year we rolled out something called Let's Move. Let's Move is kind of taking that and expanding on it. So what we do is, if we have a member's email address, every quarter we send them a calendar and we tell them all of these great things that they can do with us. So virtually they can do cooking kitchens with recipes that are really great and good for them. They can do caregiver resource support. So for example, long-term care, maybe they have somebody that is either, they have their spouse is in long-term care, maybe they're just curious about it. That's one of the topics that we do. We do things called Laugh with Yoga. So we have, and I still haven't gotten to one of these yet, and I really want to, but I'm not really sure how you relax and laugh. Anybody did laughter yoga? So I've heard it's really good though. And we also do other events periodically that enable them to really engage with us. And some of those, again, are around just being active as well. So we do some move and flow dance classes and things like that as well. Another benefit that is really an awesome benefit for members is if they've been inpatient, whether or not it's in an acute facility or a skilled nursing facility within 30 days, they have benefits that they're eligible to take advantage of. And these are really great because if you think about it, whenever they come home, they might not have access to really good meals, or they might not have the time, or they may not have the resources to have those meals whenever they get home. So we have a benefit where they can get 28 home delivered meals. They can also get 12 one-way rides. They can get that to the pharmacy or to doctor's office for follow-up appointments. They can also get up to 6 hours of non-medical personal care. So things like medication review, preparing meals, bathing, all of those things that maybe they might have trouble with at the beginning. So again, if you have members that are on our plan, really encourage them to know what their benefits incorporate, and then to use them. And if they have questions, they can reach out to us at the number on the back of their card, and we'll be happy to walk them through any of this. And finally, hearing benefit. So hearing benefit is, again, really a good benefit for them to use. They can save considerably, get huge discounts on both prescription and non-prescription hearing aids. They also have, I would say, is what's the difference between doing it this way and for them just going to get one? Not only do they have the benefit, which is $500 over a 3-year period, so they have it combined in both years. And again, it's $500 for over the 3-year period, but they also will replace batteries. They have warranties associated with those hearing aids. So it's really important for them, to utilize that benefit and really take advantage of the one-to-one service that they can get through the benefit by calling UHC Hearing. And real quickly, 2025, what to expect. If you have members who have not had our program before, they're going to get an ID card and welcome letter. It's going to talk about the program. They're also going to be able to register immediately online. So even if it's before January 1 and they're, for example, effective January 1, they can use the information on their card and they can set up their online account should they want to learn about benefits, should they want to have everything set up for that. They can start doing that immediately, and then they can use their cards effective on the effective date. And we'll reach out to them at the beginning whenever they're new with us so that they can complete a survey with us, and we can be sure that we're tailoring our messaging to them and to their needs. For anybody that has a card already, so they have our coverage, they're going to get a new card for 2025. The good thing is nothing is changing from the filing information on the card. So the information that a doctor or hospital or pharmacy needs to file those claims to us, nothing is changing there. So even if they forget to show the new card, or if they, God forbid, throw it in the garbage because they don't see it, right? Because we know that happens sometimes, that would be absolutely okay. The reason that those new cards are going out is because the benefit for the 24/7 nurse line is actually being sunset. And the reason that it is sunsetting is because members have had access to 24/7 physicians and through Teladoc and Amwell, and those things have been gaining in popularity whenever COVID happened. So members have access to that, so that nurse line is going away, and that's the only thing that's different on the card. All right, we've made it to the end. And I do have one more joke. Sorry, one more, I promise, and then we'll be done. Wait, where did it go? Where did it go? Where'd it go? Oh, here it is. Yeah, put it on the end. What happens when you put an egg in the microwave? Yes, it explodes.